Hey, good morning, everyone. Thank you for being here. Just convened a law enforcement training advisory meeting with members from police organizations and sheriff's organizations and highway patrol as a follow-up and a part of a continuing effort that we have to work together with law enforcement across the state to make sure that we are improving our policing techniques, that we are working on recruitment, that we are addressing the crime rates in our state, and as we've seen those increase across the country. So I am grateful for the men and women of law enforcement, and we are working together all across the state to make sure that we in our state protect the dignity and the humanity of the people that law enforcement serve, and also support the men and women that are in our agencies across the state. So we just left that meeting, and we'll continue to have those ongoing meetings. A couple of things before we get into questions that I want to address. COVID, for one, with the Delta variant, we continue to be very diligent in monitoring the situation. We have had an increase in hospitalizations. We'll continue to watch that. We know that we have COVID with us for the foreseeable future, and we'll continue to manage that. I want to be sure and communicate this to Tennesseans. The most effective tool that we have to manage COVID is a vaccine. Tennesseans need to be reminded on a regular basis that vaccines are available to all Tennesseans in every county, in every health department that we have, and in a variety of other places across the state. 62,000 Tennesseans received a vaccine this week. We need those numbers to continue because that is the greatest tool that we have to manage the COVID issue going forward. We want to encourage Tennesseans to talk to their doctor, to talk to their clergy, to talk to their family members, the trusted voices in their life, in order for them to make a personal decision about whether or not to pursue getting the vaccine. But we encourage that because it is the tool that will most effectively allow us to manage this virus. I want to also say a word about the children's vaccination program. There's been a lot of talk about that. Our Department of Health made a decision, and I support that decision, to make certain that to suspend for a period and make certain that we did not market vaccinations to children. So the suspension was of the marketing to children for COVID-19 vaccination. The vaccination program itself and the distribution of vaccinations continues. And we have a long-standing pediatric vaccine program in our state that we want to continue. Tennessee has one of the best pediatric vaccination rates in America. We want to continue to work on that. We want that to improve. We are continuing our back-to-school programs for traditional vaccinations for children. And while the direction of the department changed with regard to its marketing of those vaccines, to make sure that parents are the deciding factor for children's vaccinations, which is important. And I fully agree with that strategy. We nonetheless want to make sure that our children are vaccinated appropriately for the childhood vaccinations that they traditionally receive in school, and we'll continue to do that. A word about personnel changes at the department. There have been a lot of conversations about that. While there's been no disruption to the services that the department provides, especially around vaccination, there have been personnel changes. The department, its leadership, its the commissioner, as in every department in state government, commissioners and department leaders are empowered to make personnel decisions. Those do not come from the governor's office, but we support those decisions, and we encourage the leadership and departments to make those decisions based on the vision that we set out for our departments, including the Department of Health. So those decisions are not only made in the best interest of the state and of the people of Tennessee, but I encourage our commissioners to make those discretion decisions, recognizing the right role of government as well in the decision-making that they make, decisions that they make. And I think they've done that in the Department of Health, and I support that. Finally, before questions, this morning I'll be attending the State Building Commission meeting. The agenda item for that meeting is the relocation of 3 busts from the Capitol to the State Museum, and that includes the Nathan Bedford Forrest bust. It's been a year-long journey, and this is an appropriate step in that process. And I want to just thank the members of the Building Committee today, Commission today, the Historical Commission, the Capitol Commission, and those who've been a part of the process. It's most important to me that we've followed the process. We've talked about that from the very beginning. We think that we'll have the result that's best for Tennessee, but it's most important that we've pursued a process there, and that will happen shortly. So happy to take your questions.
Governor, Dr. Vazquez has said that she was a scapegoat. The department fired her basically to admit she was a lawmaker pressure. Do you agree with that statement? Do your office receive pressure to fire someone high up within the department because of the mature minor doctrine talking about this?
Yeah, so as I said, commissioners and leadership are empowered to make decisions that they think are the best interest of the department, of the people. I think that I trust that decision. I trust their evaluation of the reasons for that decision. And I think they made them for what they thought was the right reasons. And I think it's important to know that I believe that the changes in the direction of the marketing for the Department of Health was the right change. Parents are the best decider of, actually they're the only appropriate decider of the health decisions for children. And we need to do nothing in government to go around that parental decision. Government needs to provide information and education, provide access, and we need to do so to parents of those children. And that's the direction that the department took. Regarding individual personnel decisions, I trust the department to make decisions consistent with the vision.
Do you think your administration has done enough to promote the COVID vaccine? Do you think we need to step up efforts, or, hitting hesitancy? Tennessee's one of the lowest states in the country when it comes to vaccination rates. Is that concerning? Is there any steps you think?
Well, I think that we want to continue to encourage Tennesseans to get a vaccine. It's the best tool that we have to manage the COVID situation, the health situation that we have. We'll continue to do that. We'll continue to provide access. We'll continue to make it available. That's the government's role. The government's role is to provide information, to provide education, to provide access, to provide the vaccine. It's not to mandate, to require. It's not to blame. It's not to shame those who choose not to. It is to create an environment where people can make a personal decision about the vaccine. We will continue to encourage people to do that. We know that people make decisions on vaccine choices because of their interaction with trusted voices. I think people trust their doctors more than they trust the government. They trust their clergy more than they trust elected officials. We encourage people to connect with their trusted voices to make personal decisions about their health, but it is their decision. Gerald.
Governor, you previously told me that COVID, the Delta variant, is not a concern for your administration. Has that changed for you? Is the Delta variant a concern? And why did you make that change if you're changing to?
Yeah, so as we've seen across the
Delta variant.
yeah, The Delta variant has, we've seen an increase across the country as a result of the Delta variant, and therefore we'll continue to monitor that. It's, we do know that COVID is going to be with us for the foreseeable future. We hope that it eventually is not a challenge, but we have no way of knowing that. So what we do is monitor, and as we see the Delta variant, the prevalent number of cases in our state, then we will monitor that. We're monitoring it daily. We'll continue to do so.
What is that?
Which is another reason why I want to say today, and I want to continue to say, that the number one tool that we have to manage COVID-19, including the Delta variant, is the vaccine. And we encourage Tennesseans to pursue that decision. And we're glad that there were 62,000 more this week, and we hope that that number goes up next week.
Understanding that, Governor, the importance of vaccines, when does it become a concern for you? I mean, are you looking at hospitalization data? At what point, how many hospitalized patients will it take for it to become a concern for you?
Oh, it's a concern every day. We're concerned about the health. We're concerned about every health issue that occurs for Tennesseans across the day. Concerned about opioid deaths. We're concerned about obesity and diabetes, and we're concerned about COVID-19. Right now, we have about 3% of our hospital beds are occupied by COVID-19 patients. So a very small majority of those that are in Tennessee hospitals are associated with COVID, but so long as there's anyone in the hospital, we want to continue to monitor and track it. So,
Governor, you have not condemned a muzzle ban sent to a Tennessee state employee. Do you condemn that action, and is that the type of culture you want to cultivate in these Tennessee agencies?
yeah, certainly we condemn any action that is in any way threatening to anyone, and that's under investigation by the Department of Safety as it should be. Phil?
And final question for me, I apologize, but members of your security detail listened to me as I was asking you questions. Did anyone from your office direct them to do so while I was engaged in just asking you questions?
Yeah,
about the Delta variant?
my security detail has protocols that they follow, and I think that outreach that you've had is being addressed by the department. Phil?
Governor, you talked about the importance of vaccines, but last September when you were asked whether you would get a vaccine, you hedged and said you would have to talk to your doctor first. You've got your own vaccine, we're told, but in private. Do you bear some of the responsibility for the hesitancy that's out there, and do you have any regrets?
I think that I certainly don't regret getting the vaccine. That was a decision that I made personally, and
In private?
I made the decision in private. And then I went and got a vaccine at a vaccine center in Williamson County. So I think vaccine hesitancy and the numbers of Tennesseans that have gotten vaccine, for example, the percentage of Tennesseans that have received a vaccine or any other states across the country, that's a reflection of the will of people to get a vaccine. The government has an obligation to tell every Tennessean. I think we have an obligation to encourage Tennesseans, which is what I'm doing here today and what we've done throughout the pandemic. But our greatest opportunity, our greatest responsibility is to give them information, to give them education, to make it available, to make it easy for them to get, and to encourage them to pursue the right voice so they can make that decision.
My question was, do you have any responsibility? Do you have any regrets?
I do. I have a responsibility to stand before the press and encourage Tennesseans to get a vaccine. And I've done that from the beginning and will continue to do that. But I also have a responsibility to address and to remind all Tennesseans that it is their personal decision to do so, and that government is not going to coerce or mandate or force them to do that. And in fact, when the government sends that message, I believe that it allows people to be freer to make that decision. They do not feel that the government is making them do it, therefore they can pursue that personal decision on their own.
Part of the brouhaha with the Department of Health was charge of messaging, and all the messaging had to go through your office. Why have you not stepped up and accepted responsibility instead of letting the Department of Health career employees take the brunt of this?
Well, I'll be very clear. We should in no way be messaging to children. And I'm glad the Department of Health took that direction. It is my vision and my desire that we do not do messaging and marketing outreach to children.
Did your office approve those messages?
I did not approve the messages. I don't get involved in the decisions about marketing within a particular department.
Well, what about your office, your communications?
I can't speak. I don't know what the interaction was there. Our communications team talks and interacts with, as they should, communication teams from all departments. But if I had been consulted and asked about that particular outreach, I would have said we should not be marketing to children. I still believe that. I think it's appropriate. Parents need to make decisions. Parents are the deciders. It's inappropriate for government to pursue a vaccine that has been approved on an emergency basis for children without consulting their parents. That's a mistake. And to the degree that that was inadvertently happening in any way, we should have stopped it, and we did, and that was the right decision.
Dr. Fiskus, one thing I wanted to ask before Harry goes is to follow up Phil's question. Dr. Fiskus has said she was simply passing along what your administration had already approved. So why then terminate?
Yeah, I can't speak to what Dr. Fiskus says or didn't say. I just trust that, and I'll say this one more time. Our department and the leadership made the decisions that they think are in the best interest, and I fully support those decisions. Yes.
So here's my question, Dr. Lee. First of all, I've got a couple. Again, carrying on what Jeremy said, Dr. Fiskus communicated a law. Why was there nothing to say to the lawmakers who criticized her for communicating a law that they can control?
Yeah, I wasn't involved in the communication with. That's right. And so what I do is I cast a vision for a department, and I expect that department to carry out that vision, and to do so in their communications with the folks in our department interact with lawmakers all the time. The folks in our office interact with lawmakers all the time. That's appropriate. It's the way it should be. I want to know what the state reps and the state senators have to say about issues that they represent the will of the people. And I'm very much committed to fulfilling the will of the people and what the people in Tennessee want to happen in their Department of Health with regard to the direction that departments take. So that interaction is appropriate.
And let me ask you, switching gears just a little bit, the state has an open tab, an unpaid bill to Tennessee State University regarding the land grant, and it has admitted that nearly $500 million. Also, federal unemployment has been cut for thousands of people who are still suffering. But yet, we're not paying the bill to those at Tennessee State University supporting those who are hurting. But yet, we're paying for plane tickets. How do you justify not paying an open bill and people still suffering, but we can buy plane tickets?
Yeah, so you talked about three different issues there. One of them is TSU, and I've met with board members at TSU multiple times in recent weeks. As you know, that the legislature will make decisions about funding for TSU, and the leadership from legislature is meeting with officials as well. So that's it's been ongoing for many years, the resolution and how to fund and what that should look like. I suspect there'll be continued movement and action on behalf of the legislature. I can't speak for the legislature there, but I know they're talking about that issue. So that's ongoing, and that there'll be resolved to that at some point. Tourism is the second leading economic driver. If we want people to go back to work and to have opportunities and to have economic opportunity in this state, then we better be supporting tourism. And an innovative, effective tourism marketing plan is one of dozens of ways that we support tourism, and I continue to encourage the Department of Tourism to do that. unemployment benefits. There are half the states in this country that have suspended that, and they've done so because they, like we, have 250,000 open jobs and 100,000 unemployed. There are job opportunities for people in every county and in every city in the state, and we need to make sure that we create an environment that moves people from unemployment to meaningful employment, and that decision will do just that. Yes.
I just have one final question about that.
Okay, we have a lot of reporters, so we're going to need to move through quickly, okay?
We've got a lot of folks on the
Right,
phone with this
right.
important. With litigation now pending in Tennessee to restore federal unemployment, do you have any plans to restart benefits and avoid costly litigation?
I do not have any plans to make a change in that direction.
The top Republican leader in the country, Senator Mitch McConnell, says that people need to get vaccinated or risk restrictions being returned. Do you agree with that statement? And at what point would restrictions return to Tennessee?
Yeah, I don't have any plans to return restrictions, but I do have plans to continue to encourage Tennesseans to get vaccinated. And I agree with him that we should that people should get vaccinated, that they should be given the opportunity to get vaccinated. As I said, our role is not to coerce or require or mandate. Our role, the right role of government, in my view, is to provide access to it and to encourage it and to make it available to everyone that qualifies for that. That's what we'll continue to do.
Governor, can I ask a little quick question, jumping in? I wanted to ask about, there's a huge anti-vax seminar organization that is going to be opening up here in October. You're having a huge anti-vax. Are you concerned at all that anti-vax advocates are, if there's a perception that Tennessee is becoming anti-vax, you talk about marketing, is there a concern that anti-vaxxers are truly bending your ear?
The greatest concern I have is that we provide accurate, appropriate information from the state. That's what we are here to do, is to provide information, education, access. What other people do, we certainly can't control. My concern is that we provide access and that we provide it to the right people. That would be parents, for example, and not children. That's what we'll continue to do as a state. Now, but we need to keep moving, and then if we have time, we'll get back. Yes?
So my question is about schools.
Mm-hmm.
This week, the nation's leading pediatric association released school reopening guidance, recommending essentially that everybody wear a face covering at school, even if they're vaccinated against COVID. And in addition, the CDC says unvaccinated students and staff and all students under 12 should wear masks. And yet, from what I can see, only one school district in Tennessee, Shelby County Schools, has announced they will follow that guidance. So my question is, with school starting next month for most Tennessee kids, are you concerned that our public schools aren't planning to follow science-based guidance at a time when COVID is surging with this Delta virus?
I think one of the most important things when you talk about science-based guidance is that the likelihood that children will get seriously ill is incredibly low with regard to COVID. That's one of the reasons I think that school districts have made the decision not to require masks for children. I don't think they should. I hope they don't make that decision to require masks for children in our state. We have protection for adults available to any adult that wants it. And children, statistically and according to the science, have an incredibly low rate of severe illness. So I suspect that that is a district decision, as you know, in this state, but I suspect that most districts will not require masks, and I support that. Yes?
Governor, I have two questions. So you said you would like parents to be the ultimate decision maker, but the state has not only halted vaccine outreach to teens, but also about teens, and not just COVID-19, but for all vaccines. So that backstepping and messaging seems to run contrary to what you just said. You believe that you should encourage people to get vaccinated. You believe that children should be vaccinated. So, how
I think that adults should be the target of all marketing. I think that adults should be the target of all outreach. And I think our Department of Health should be vigilant and persistent in that outreach. That we need to make it available, that we need to continue to talk about it, that I will continue to encourage Tennesseans to pursue the information that's available to them. There is a tremendous amount of resources available beyond the Department of Health, but including the Department of Health. And there are tremendous opportunities or places for access to get a vaccine as well. So my statements are simply that we should not halt vaccination in any way across the state. We should make certain that we're targeting our outreach and our marketing to the right demographic. Yes.
Sorry, one more question. So, an internal report obtained by the Tennessean says that the health department has critical gaps when it comes to the vaccination program. There are also two top officials also left, and then Dr. Fiskus was fired. So, how confident are you in the Department of Health's ability to deal with the situation now we're facing a surge in the variants?
Yeah, I'm very confident in their ability to fill the positions that are needed to be filled and to continue the vaccination distribution plans that we have in place.
Governor, earlier this year, the legislature passed a bill requiring an adoption of a universal literacy screener. In the RFP process, the Department of Education has obtained a literacy screener that includes a mental health component. Was the idea to add a mental health component that goes above and beyond what was passed in the legislation? Did that originate in your office or with the Department of Education?
Yeah, that would be a question you'd have to ask the department. The specifics about the details of that literacy program.
Do you support the addition of a mental health screener?
I haven't read that. I'll look at it and get back to you and let you know.
And later today, if the State Building Commission does approve the removal of the Nathan Bedford Forrest bus from the state capitol, do you have a timeline of when your office would take action on that? The State Museum has indicated that they're waiting for guidance.
Yeah, well, we'll take that one step at a time. We have the meeting first, and then we'll convene to decide what the next step is and when.
Governor, your tourism commissioner apologized yesterday to lawmakers for the rollout of the Tennessean Me program. Do you feel the need to apologize as well?
I don't. Not for outreach by the department. I don't know what he apologized for. It may have been the style in which it was rolled out, but he and I both know that tourism is incredibly important in our state. And we will continue to promote tourism, and we'll continue to encourage Tennesseans to travel to this state from places all across the country. Stephen?
Do you agree with the GovOps chair's statement yesterday that it's reprehensible and immoral and possibly illegal to incentivize parents to get their kids vaccinated?
Well, I'll only make statements for me, and for me, I think it's inappropriate for government to target marketing for children's
What about
vaccines.
incentivizing parents to get their kids vaccinated?
I do not think that we should incentivize people to get a vaccine.
Governor, we've got Sam and Natalie over here.
Great.
Their last two questions.
Thank you.
Yeah, Governor.
There you are, I'm sorry.
Don't you feel that, considering Commissioner Pierce is in charge of the Department of Health, she shouldn't have taken the responsibility for the messaging and everything that wound up getting Dr. Fiskus fired?
I'm happy to take responsibility for the messaging. I didn't make the specific decisions about that. I didn't make personnel decisions in that department. That's not what a governor does, but I do cast a vision for a department, and I support my commissioner and her decisions particularly regarding marketing and messaging to minors. That's something that I'm supportive of and glad that she did.
Why didn't she tell you she fired Dr. Fiskus?
Sam, do you have another question?
Well, you say you're supportive, so you're taking responsibility for the messaging that went out?
I'm supportive of the messaging. I'm supportive of it. I don't make decisions that are made internally in departments, but
So you're accepting some of the responsibility for the messaging?
I'm supportive of it.
Yeah.
Natalie, do you have a question?
Yeah, Governor, are you currently having your Office of Faith Based and Community Initiatives work with churches to talk to the parishioners about the vaccine, or is that something you would consider doing?
That would be that would clearly be something to consider, to talk to clergy about being a voice, a trusted voice for Tennesseans. Haven't spoken to the director of that office about that, but I actually like that idea.
And do you have any other thoughts on how, besides sitting here in front of the camera, how you can get to people who are maybe in rural parts of the state who are surrounded by folks who are very hesitant to take the vaccine?
Yeah, I think that we, in the Department of Health, have outreaches specifically targeted to populations, both rural areas with some of our mobile units that are going to communities. Also demographic communities, that African American communities, Hispanic communities that have greater hesitancy levels than some of our other population. There's a targeted and a specific outreach to that. I think the department's trying to be creative and innovative in that all the time, and we want to continue to do that because, as I said, vaccinations are the #1 tool that we have. Yes, sir, I think you had a question.
Because Commissioner Piercy obviously made the decision, did she tell you why she was firing?
I haven't discussed that with Dr. Piercy.
That is all.
Thank you.
Thank you.